All right. Can everybody see my screen? Awesome. Yes, welcome. Today I want to talk about different ways that we have been leveraging hackathons over the last few years to help drive additional innovation and really jumpstart a project. Today I'll go through a few things, a brief introduction of PCCI and Parkland Health, talk about what I mean by a hackathon, how are we defining it, why is it innovative and different from a normal data science project. I'm going to showcase a couple of projects that we've done in the past and make sure to go through kind of the step-by-step results of what some of those looked like. Um, Followed by the integration of this with, I'm cheating a bit. I'm using the Health
I
AI
didn't think so.
Partnership
I mean,
Roadmap
with
for coming up with the AI life cycle. And so kind of mirroring that life cycle with how a hackathon would fit in. And then the lessons for success. And in my mind, it's a how-to guide. What do you need? What are the components that you would need to have a successful hackathon? Talk about things like stakeholder buy-in and the impact of it. I'll try to be as brief as I can. I know sometimes I can talk fast, but feel free to put questions in the chat, and I'll make sure to leave time at the end for us. PCCI, the Parkland Center for Clinical Innovation. I'm the CIO at PCCI. I've been with the organization for over a decade now. Trained as a mathematician and data scientist, been developing and implementing models for Parkland Health as well as health plans and county officials in the Dallas and Texas area primarily. Our focus as an organization is to leverage non-medical drivers of health or social determinants of health to be a leader in innovation and understand a whole person. So you'll see that in the hackathon showcases that I have today, that we're not just looking at predicting one medical outcome. It's been a diverse list of hackathons and topics that are focusing on the person as a whole, not always about the medical condition, but about some of the behavioral work that behavior that a patient may exhibit when in a hospital setting as well. A little bit about Parkland. Parkland Health is one of the largest county hospitals in the United States. If you're not familiar with it, it's located here in Dallas, Texas. It serves as a level one trauma center for about a 200-mile radius of anyone in a traumatic event. One of the number one burn units in the country. Delivers, I think, the third most now babies in the United States. I think there's some crazy statistics like 1 in 35 Texans are born at Parkland, and 1 in 100 Americans are born at Parkland. But really a large a hospital with about 860 inpatient and observation beds, about 250,000 ED visits per year. A very, very large health system. Very thankful to be working with Parkland Health, being born out of Parkland Health, to be able to leverage some of the data for the hackathons and the innovative solutions that we have. It's a bit of a different payer demographic and demographic in general, with Parkland Health being a safety net hospital. It's primarily charity, Medicaid, Medicare. It's not a lot on the commercial and the for-profit side on the insurance payer mix. But that's why we end up leveraging a lot of our non-medical drivers of health as drivers and predictors into the predictive models that we use. So important to know that going into these hackathons because I'll be referencing it a few times. So innovation. Why is it important? What is a hackathon? How can it be innovative? If you wanted to do this in your organization, kind of what are the parameters that you need to set? So the first thing I want to talk about are some of the necessary components. I've tried when I first wrote out the list, I think I had 16, and I was like, that's too much to show on a slide. People are going to hate me. Let's narrow it down to four. The four necessary components that I think are really helpful is one time bound. You may have been a part of hackathons or commercial hackathons where people give you 24 hours to solve a problem. Well, the way that we've done it is a fixed window of 2 to 3 days. That's an important window to keep in mind. You think, hey, maybe if I go to 4 days or 5 days or a week, I'm going to get better results. It's not always the case. forcing the team to know that they can only operate within a small window of time is going to force decision making. It's going to force the prioritization of what to look for, and it's going to avoid scope creep, which is one of the biggest challenges or potholes that you'll step into with a hackathon is you come in with an idea and you come up with so many more ideas during the hackathon that you lose track of where you started. The point of the hackathon is to be innovative and solve a single problem. One of the benefits of a hackathon is, we kind of pause the other work and everybody comes in together. We get this diverse collaboration. We get our clinical teams, we get some stakeholders, we have people flying in from who knows where to talk to the team. It's not just put a data scientist in a room and watch them go. We've had, and you'll see this in some of the showcases, we've had report writers, we've had people who specialize in geospatial analytics, people who are machine learning engineers, not necessarily a data scientist, but you can actually bring in collaboration. Those are the people who end up winning, are the ones that bring in the outside expertise, really helpful. The goal is not to be business as usual. We really want to be unique in creating an innovative solution, something that you're not just going to do anyway. It's not, the same day in, day out. This is a new approach. You want to encourage testing new use cases. We want to try and kind of break things quickly so that you can come back and come up with a solution quickly. And then experimentation over perfection. We want imperfect models. We want to see things fail and fail fast. It helps to protect that creative environment to allow people to propose ideas, test those ideas that otherwise in normal workflows might be dismissed as unusual or not really as helpful. Um, and so these I think is how we're defining what our hackathon is. What are the necessary components? How is it different? A traditional AI lifecycle. I mean, there's diagrams that are really long and rigid, but in general, you got a problem, you create a model, you evaluate it, you deploy it, you monitor it, and so on and so forth. Very traditional. Your hackathon needs to stick to three main components. What's the idea? Really quick solution. Figure out if that solution worked, and then go back to the idea stage. Very cyclical, very fast. You want to try multiple different things. I feel that teams who work on hackathons, if they only tried one solution, really don't get as much out of it as the teams that have tried multiple solutions in a quick, iterative fashion. I'm going to talk a little bit about the projects that we've done in the past, just to give you a flavor of what these look like. And as I do so, I'm going to also show some older slides, so apologies for the format change here halfway through, of kind of what we set the stage for those hackathons, so that you can see what information was given to people, how did they absorb that, and then the results of some of those hackathons. So, whoops. Yep, nope, here we go. All right. So we've been doing hackathons since 2023, and usually we do one a year. We did two last year. In 2023, we had a workplace safety hackathon. This predicts the likelihood that a patient may have a violent event against a staff member during this day. Workplace safety is a major issue. You shouldn't have to go to work every day expecting to have a bedpan thrown at you. And so we wanted to identify those safety events as early as possible and who's going to commit them. That was that challenge. 2024, we created a diabetes and hypertension surveillance system. So instead of predicting the behavior like in 2023, we wanted to predict and forecast what areas, what zip codes, what census tracts and block groups in not just Dallas, but the DFW area, 16 counties, was going to have a higher rate of ED admissions and hospitalizations for diabetes and hypertension. So we wanted to use multi-year data across multi-sectors, not just one hospital, but multiple hospital data to understand where those trends were going and see if there was some additional outreach that needs to be made in those specific geographies. Last year in the spring, we did a digital engagement score. So this was a clustering exercise. So you'll notice these are different methodologies, different processes. So we did a clustering exercise to see who is a similar person to engage in the system using digital means and digital resources. What I mean by that is using, the app with the EMR, who was leveraging virtual visits, who was answering the phone call at a high rate or responding via text message, who's engaged with the system using digital resources. And we wanted to group that into three different groups. People who used it a lot, people who used it a little, people who were kind of in the middle, or and then the point of that is to have outreach to kind of that middle ground or the people who don't use it to try and educate them and get them using those digital resources. Because the more that they use that, the more engaged they can be with their health. And so that one, yeah, it was a clustering algorithm. And then in the fall, we did a hackathon. This was just a one-day hackathon on ALS. The point of this was to use genomic data, which was a first for us, as well as discrete data to predict the progression of ALS, also known as Lou Gehrig's disease. So this wasn't predicting if someone will get ALS. There's a lot of models out there. There's a lot of genetic information out there. This is once you have ALS, how fast are you going to progress? And are there specific characteristics around patients who progress fast versus slow? I'm not going to go into the details on that one too much. I'll put a copy of the press release in there because we are working with some third parties, and it is the model itself is still in development. But I will talk a little bit about the first two. So the workplace safety model that we had, we set it up like this. We set up rules and objectives to teams of 2 or 3 people, no more than three. Every group has the same data set, and you have until 2 o'clock on the next day to submit your final model and compare it to a holdout set. You want to make it fun. So we had them, you had to come up with a team name, it had to be a fun team name. You had to write documentation. You had only one slide to show your results. So this is not going to be a 30-minute presentation on hackathons like I'm giving today. You had one slide to show what your final results were, and you had to present that to the stakeholders who oversee the violent events at the hospital. So kind of a challenge. So it's not just about the data science. It's not just about creating the model. There's some presentation skills that come with this, and you don't have a lot of time to think about it. So the objective of that model, I'm going to dive into this one a little bit deeper. The objective of that was to understand violent events in healthcare and identify specific elements that would flag or lead to a patient potentially becoming violent. And can we use that to correctly predict if a patient will become violent in their next encounter? And so we gave the team 4 different data sets. We gave them data sets from the medical record. We have correctional health from the jail data. There was a monitoring system that people could report to. And then we used the social determinants of health over a 5-year period. So we took 55,000 unique patients, aggregated up until their next encounter, and then they had to predict if that next encounter would be violent or not. We gave them 157 variables. Some teams only used, 15 or 20. Other teams somehow magically got to 250 by using derivations like dates and, time of year, trying to find some seasonality, providing them with a data dictionary. The prevalence rate on this is small. It's about 2.4%, which is even higher than the actual incident rate. But for the purposes of a hackathon, we wanted to have it a little bit higher. And then they would train it on the 55,000, and then we kept back 11,000 with about the same prevalence rate. And that was how we did the evaluation. So the winning team, this was their final slide. So it's Team Pumpkin Patch. Again, keep it light, keep it fun, come up with some fun names. I don't know why they came up with Pumpkin Patch, but that was their team name. This was their one slide. So they said, we want to show our process. How did we get from the data to the final results? And then we wanted to showcase really 2 or 3 main objective results. So in this case, they actually did a fantastic job of the roughly 300 or so, a little bit less, 280 violent events. They were able to identify 250 of them. It was a very good outcome, a very good model that the patient would become violent at some point in their next visit. So really impressive. The team saw this and said, "Wow, there's real signal. We can actually make this into a deployable model." And so the next step after this hackathon was not just will the patient become violent, but at what point in time. And so we took the next year after that to develop the much more rigorous point in time prediction that is in production today. The second hackathon we had was that diabetes and hypertension surveillance system. This was actually a flyer that I had put out for the team members to sign up of who wanted to do this. This was back in 2024 in April. And again, we wanted anyone who had any sort of coding experience or even mapping experience to participate. And it was great. I think this one we had 18 participants in it. And the objective here was to create a surveillance system for patients with diabetes and hypertension. Again, we're not looking at just one data set for this one. We looked at the CFW Hospital Council Foundation data across 16 counties. Um, and the ED visits and the populations therein. We kept it simple at the zip code level for this, but later we did do this model for more granular geographies like block group and census tract, overlaying a lot of the social determinants of health, which I'll show you here in a second. But they have 51 zip codes. Uh, we had 51 zip codes were held out. We gave them 200 and something zip codes, I forget how many. And their objective was to, using those other zip codes, predict how these 51 zip codes are going, how many ED visits are going to happen in each of those zip codes over a 12-month period. So they had data from like 2015, 16, 17, 18, and then 2019. They had data, but they didn't have data on the 51 zip codes. So they had to predict those 51 zip codes, and they didn't know which ones they were. Um, and be able to predict those using their model of how many ED visits for both hypertension and diabetes. And so their results must include a map as well as an explanation. We didn't limit this to one slide this time. We thought that that was too restrictive since they needed to show more visuals and not just and their methodology. Um, so this was one of the resulting presentations that they had. This team decided, and I'm just showing it here because it's a different approach, they didn't want to use previous year's data. So I thought, setting this hackathon up, that this would be a forecast, a trend. 2016 would feed into 2017, would feed into 2018 to predict 2019. That was the intent. They said, no, we don't need the previous data. We just need the 2019 data in the other zip codes and find similar zip codes and demographics of people in those zip codes to see if it's rising over here, it's going to rise over there as well. So it was a data-driven approach that was unique and different. And if you asked the stakeholders and you asked, a data science expert like myself, I would say, no, this is a silly approach, but it ended up being the best one. And so, this was the process. They used 4 different predictive models because it wasn't a time series. They could use a lot more tools in their tool belt, allowing for that flexibility. And they were supposed to make sure to present what specific things are driving those ED visits. And so they created a compass, and this was innovative. This was thoughtful. We didn't tell them to do this, but they created on the map 4 main categories of feature importance. So history of ED history of ED visits was one. Your demographics like sex, age, insurance status was another. Your social determinants of health data, such as number of grocery stores in that zip code, was one of them. And then one of the variables they found was a really important one, which makes sense for diabetes and hypertension, was the prevalence rate of the adult cholesterol screening. And so different zip codes you'll see on the right here had different important features. Some had 1 arrow, some had 2, some had 3, meaning that specific zip code's ED visits were being driven by those different specific features. So a really innovative, really cool approach. If you zoom out to the 16 catchment area, it got really busy really fast, but each zip code got their own little arrows. And this was a way to look at the volume. This was a way to look at the reason. And so they went with that approach. And they had to predict it for 12 months. So 1 is January, 2 is February. The actual number, how many ED visits are going to happen. And so they have a range, a box plot, and an average, and their average was their final result. But there was some variability. So really innovative approach. Their lessons learned were that they loved collaborating. They loved problem solving. They learned time management and coding. And if you've ever coded before, you know that it can take a lot of time and it can take a lot of effort and a lot of energy. And being in a hackathon environment, you don't get that luxury. You don't get that ability to just take your time and say, oh, I'll just deal with it tomorrow. You got to make a decision. You got to put in something and you got to move forward and move on. So it's really nice to bring ideas together. I like this slide. They wrote this. I didn't. And then a good understanding of what's going on in the world and what's going on in their backyards because we're located in Dallas. And so it was good for them to understand what a community health needs assessment was. They got to talk in person with the stakeholders that run the diabetes and hypertension programs at the hospital, and then use data that was beyond what they normally work with. And one of the groups even put in a little bit of widget. This was what I was saying. You don't have to be a data scientist. They had a person who was more on the geospatial side and less on the data science side. I know this is a little fast. I couldn't slow it down. But basically, they wanted to say, here's our prediction of ED visits by zip code for the 12 months and where the hotspots are going to be. And so this information is now being used fully in production right now. And in fact, if you're interested, not that I don't want you to listen to what I have to say, but oh, it's not letting me. But I will drop in the chat here. Actually, I do have it. Give me one moment. I'll drop in the chat here if you're interested. This is my shameless plug here. This is free. Open source. Uh, Hang on. Here we go. This is the just an open source website where the results of this hackathon and the additional great work by the team have all accumulated into this website that the team now uses to go in and understand where the risk and vulnerable areas are for diabetes and hypertension and compare it to other social determinants of health that are relevant. And we kept it at a high level at the zip code level for some HIPAA concerns and things like that. But feel free to play around with that. It was a great result at the end of and a result of the hackathon. So where are they now? These models, workplace safety is in full production. It's being used at, I think, 12 units at Parkland Hospital today to trigger an intervention for patients that might be at high risk. And the staff can take additional steps to ensure the safety of the staff, which is great. The digital engagement score is still being implemented. We're in its pilot phases here in spring of 2026 of how they want to do the outreach. We're talking about using certain AI components for outreach for patients so that we can get them more engaged in their health. And then the ALS is very fast-tracked, working on collaborations with a variety of different groups. We'll drop when I share the slides as well. Feel free to check out the press releases and some of the notices on these if you're interested in learning more. AI lifecycle integration. So I adopted this from Health AI Partnership. A little bit biased here because I think that the group does just an absolute amazing work. But they've got their AI adoption framework, and if you haven't read it, you absolutely need to go look at it and read it. It's got eight points. It's straightforward on how an organization should adopt AI. And I know that they built that and they put that out years and years ago, and it still holds true today. It has absolutely solved the test of time. But I wanted to talk about each one of them and just a little bit about how the hackathons specifically are beneficial. So one is identify and prioritize the problem. If your hackathon doesn't have real meaning and a real world challenge, the engagement just won't be there. You need to be able to have clinical or operational leads be involved in the process, that this problem is going to make a difference and that what you're doing is going to make a difference. And that really gets you buy-in. People wanted to work on these projects overnight. We said, no, you can only work on it while you're here for fairness. But even after the hackathon was over, people were just still thinking about the problem, reading articles, coming up with ideas, and sending it to our teams to say, "Hey, I was, thought about this idea. Could that help?" And it's really important if it's ingrained in a real world challenge. The scope and intended use is absolutely vital. You've got data constraints. You've got time constraints. A hackathon is not the time to tell your people, go find data to solve this problem. You need to have the data ready. You need to have the scope identified, and you need to have a quantifiable way to measure the outcome. This really helped to give clarity on whether or not it's viable. We've had a couple of projects, not quite in the hackathon, and I'll explain why later. But we've had a couple projects where it's just not viable. It's no better than a coin flip. You try to throw AI at it, you try to solve the problem, and it just doesn't work sometimes. Failing fast is important. And you can use a hackathon to do that. Success metrics, they must do a pitch. We force our teams who are normally like to live behind a computer to talk and stand up in front of a crowd and speak about what they're doing. And that's uncomfortable, but it's important. And it's a good culture add on, a good culture to have. And so they must be able to explain their success criteria and explain their results. The solutions workflow. This is sometimes for a hackathon. So sometimes the results will require a workflow integration. Um, for example, the surveillance system that I talked about for diabetes and hypertension, it was the intent was always to create maps and have those maps be available to the public and have the public use those maps to make decisions on where to put resources. And so that was part of the pitch. That was part of the opening speech from the stakeholder that this is going to be ingrained in this specific workflow. The workplace safety one, the workflow wasn't really defined at the start. We want to identify patients who might become violent, but I'm not really sure how we're going to use that yet. So it can be one of either way. Um, the safety, efficacy, and equality. There have been plenty of sessions here with HAIP and others that talk about the equity and equality of a model. This has to do with some of the preparedness that I'll talk about later. Is you need to make sure that your data set is put together correctly, and there's no PHI leakage or risk of that. But it does allow for quick bias checks. We had one of the models where within the first 10 minutes, one of the data scientists said, "You made a mistake. You accidentally included this wrong." And they found it really fast. Having that many heads in a room allow you to be able to have the most efficient data set. Solution rollouts kind of similar to the workflows, monitoring it, again, pitching, how should this work, displaying their results in dashboards, maps, etc., and then decommission. Decommission if it doesn't work. I mean, part of it would be, hey, if we spend 2 days and we can rule out, a project, that can still be a win. And that's part of a hackathon is if you're going to fail, fail fast. So what do you need for success? Kind of the last little section I've got here. People and process. So on the left, it's got to align with your current AI lifecycle. I just went through 8 health AI partnerships, but you've got to still follow the normal process for you've got data, you're going to explore, you're going to build, you're going to result. You got to follow the input process output framework. But on the right, we've got people. Who do you need? When I first a decade ago, I said all you need is a data scientist. I'm a mathematician. I'm like, you don't need anyone else. Put a mathematician in a room with data. They're going to get you your results that you need. I've matured a little bit, I think. I hope to think. And you need more than that. You need a domain expert. And the domain expert doesn't have to be on every team. We use our domain experts as floaters. They come to the hackathon and they walk around and they talk to each of the teams and provide them that expertise. It is imperative that you have domain expertise in a hackathon, or else the results are not going to make sense. And then I added this as well. You need a communication, operation, visualization person. I don't want to speak for all data scientists, and I'm sure there's some on the call that disagree, but usually data scientists are not the best at communicating their results. At least that's been my experience. It's really helpful to pair data scientists with report writers, with operations, project managers, product managers. They give a different perspective and they can still take the results and present it in a way that is more digestible. And presentation still is everything when it comes to, if you're comparing on a hackathon, who's going to win or whose model is better than the other. Yes, there's mathematics, but there's also a subjective part to that. Who else do you need? You need a stakeholder. And I say need because I really think you need it. And you need the buy-in from a stakeholder. If you're doing this exercise just as a research exercise for fun, and then after it's over, you go on your merry way and you never look at this project again, and that's because you don't have a stakeholder who truly, truly cares about it. The way that we have gotten some stakeholder buy-in, I put a couple of ideas here, is one, directly impacts their priorities and goals. We've done some projects, not quite as a hackathon, but if it's impacting the bottom line, it's impacting their corporate goals, their bonus structures, they're much more inclined to be engaged. Um, Talking with stakeholders on how it brings together a multidisciplinary approach really does help get the buy-in. It's not just one person in a room solving a problem. You're going to bring in a workflow person, a supply chain person, a director over here. It really does create that collaborative environment. It's a low financial risk. I mean, in the grand scheme of things, if you take 2 days out of the year to do a hackathon, with a team, relative to everything else that's going on, that's a relatively low financial risk for a massively accelerated innovation. Um, it helps build confidence. So usually, if you have a stakeholder, they have a hypothesis. Like, I believe because I've been here for so long that this is the case. You can validate it. You can build the confidence. You can put data behind it, and you can, show that what they're saying is actually true and pointing to it, which can also, potentially even lead to publications or patents or other, wonderful things that helps to bolster the confidence of that stakeholder. The next one I really like, and that is that it strengthens the internal culture of your organization. It bolsters creativity, it leads excitement. The team loves eating pizza, or I think we did halal guys last time. In the rooms with all the computers going and all the brain power going. It's a fun culture. It's a fun environment. And then I mentioned before, quick failure is always a win. Proper preparation. When I was in high school, my high school guidance counselor would add an additional P in here. I didn't think it was appropriate to put it on the slide, but I'll say it anyway. It was proper prior planning and prep prevents piss poor performance, and it's so true. If you just come up with a data set, say go do a hackathon, it's not going to be that successful. There are three main keys for proper prep. One is the data. Keep it simple. Don't use more than three. That's what we learned the first time. We did 4 data sets, and the team gave the feedback it's too much. No more than 3 data sets. Keep it simple for what those data sets are. Have a clear data dictionary, clear labels, clear articulation of how these things are defined, and proper de-identification if necessary. Test it. Before the hackathon, I always get one of my principal data scientists and myself to see if the signal is real. If I can do it in an hour and prove that I have better than a coin flip prediction, then I know that the team is going to do much better than I. They're smarter than I am. They're going to do an amazing job and create an even better model. So test that outcome before you even go in. And then the run of show. Have guest speakers, have an agenda, plan a lunch, clear expectations, set them with times. They've got their deadlines. They know when the deadline is. It's not just, arbitrarily ending. Have a run of incorporating, your operations team, your project managers. They love to do this and hand this off to them to run it for you. It's great collaboration. This one might be controversial. I'm not sure. I think with this group, they'll probably agree with me. I think you need an AI assistant involved in your hackathon. I've got the hype curve on the left. You've probably seen that before. Where are we with the AI LLMs? I think we're still between the innovation trigger and the peak of expectations. I don't think we've peaked yet. Other folks think we have. But on the right, you'll see, I like this graphic. How long did it take for each of these applications to reach 100 million users? Netflix at 10 years, Twitter at 5 years. It took ChatGPT 2 months. And I love the quote from the social network. I can't give drugs away to that many people in that amount of time fast enough. I mean, it's in incredible innovation in the world of data science and the world of healthcare. And so if your team is not leveraging some kind of coding assistant, even if it's, your Copilot or your Google Gemini, just to help answer questions, help with getting some basic code, even, not necessarily uploading your data to any of those, but having it as an assistant is absolutely imperative to the speed and the quality of your hackathon. Specific outputs. There's so much going on in a hackathon. It's almost like a fog of war. You must have a clear objective. What do you expect the final result to look like? This here was, I think, the digital engagement score objective. We told them you have an objective and subjective criteria, and here's how you're being scored by the judges. On a 1 to 20 basis, objectively, how well do you achieve your result based on covariance? And then you've got a score of, what's that, 10, 20, 30 points that is completely subjective. Novelty, accuracy of the approach, how you're sequencing the data, how you're treating the data from an exploratory perspective, and just flat out stakeholder preference. You got to be able to present your results in a way that subjectively looks good. So finally, I'll wrap it up here. Lessons learned. Design the hackathon. Use these core processes and these core ideas to help solve a problem. That problem's got to be something that's meaningful. Use your data properly. I'm a CIO. I have to always put in some sort of security plug here. And then coming up with team names, coming up with little prizes. It doesn't need to be anything expensive. You'd be amazed at what people will do for a $20 speaker or an Amazon gift card. Have a fun environment. Bring in other people who are not involved to just come hang out, and have them coming back and wanting more. So with that, I'll wrap up what I had and see if there's any questions.
Thank you so much, Albert. This was a fantastic presentation and very innovative way of like promoting innovation culture and also bringing in great ideas to like practice and putting them in workflows. Yeah, everybody, please feel free to put your questions in chat or unmute yourself and ask directly if you have any questions for Albert. I will start us off. So I always am fascinated by like behind the scene operational details about like running something like this. I'm sure it's for this 2-day event probably needs a 3 month or more of preparation. Uh, so, so I think my question is like, I think you explained that you have to keep the data ready and the problem statement and all of that you provide to the participants. And there's clearly a value proposition in this event. So if you could share, like, how some behind the scenes of like what is the exact process, like how does the strategic priority come about? Is it through like the leadership? Is it from the problem statement that you're seeing? And how much does it take behind the scene to prepare that databases and data sets for the hackathon teams? Yeah.
Stakeholder buy-in is where we start, and I'm very fortunate. I think my boss is even on the call here. But having your leadership from the top down support this and show the support for it and be encouraging and excited for it is really helpful. And having that stakeholder who's going to show up and present the problem to the team, it really gets the idea out there. For the data set, yeah, it's about a 3 month prep process. I usually have that one data scientist. I'm saying, hey, is there signal? Create the data set in a similar way, in the safe way that we do for all of our other projects. For example, now we've identified with our stakeholders just 2 or 3 weeks ago what we're going to do for this spring, and I've got the data scientists already pulling the data, de-identifying, and figuring out how they're gonna share that correctly and effectively with the team. And it does take a little bit of work on the prep, but it's totally worth it.
Thank you. That's awesome. And what happens after the event? Like how involved are the teams in like taking the idea further and like because I'm assuming once you have that like promising idea, you probably need a lot more domain expert like consultation as well as like workflow builds and to put it into practice. Yeah.
Yeah, it really depends on which one it is. So, I'll give you the examples that I had. The workplace safety, we did a patient level prediction for the hackathon. And then as a result of the hackathon, it was great results. So there's signal, but we said, okay, I've got a patient that comes back to the hospital 50 times a year. Just because you're predicting, flagging them as high risk, do I need to be on alert 50 times a year? And it was, well, no, the violent events was only two out of the 50, right? So we took it as its own project, working with the stakeholders to create an encounter-based prediction. So for every encounter, you get a score and the likelihood that that encounter will lead to a violent event. And so that took an additional year, year and a half, to build out with a full team. And the team that won the hackathon kept the project, and they got to keep working on it and build it out, and then showcase it to the rest of the team. A little bit of pride there.
Awesome. That's awesome. Um, any questions from the audience here? Yeah, Teresa.
Hello, thank you so much for this. This is very interesting. And I think having these kind of collaborations with the entire system would be really nice. But I do wonder, not everyone has coding capabilities, or we don't have a team of dedicated data scientists. Do you see other use cases where perhaps we could leverage AI? And also, for example, we as at Beacon Health System, we use the Microsoft Suite, so we use Copilot. But I'm thinking if we're trying to ideate a quick solution to get quick prototypes, how do you manage data privacy as well? Like, having, I don't know, using external tools or these, what are they called? Low code or vibe coding apps, but also, like, do you use then dummy data there to not put in data from your own organization? Yeah, because anything that I imagine that we would do in like in hackathon would be with very little to no code solution. So if you could provide any insight there, I would appreciate that. Thank you.
So I scoped out a hackathon idea that we didn't do. It was other priorities, but we wanted to allow anybody at the hospital to participate regardless of coding. And we wanted to leverage Copilot because that everyone has access to it. There's the way our system is set up is that there is a web version and a internal version of Copilot where you can turn off the data being sent out. But regardless, we didn't want to put the all the pressure on individuals if they accidentally, hit the wrong toggle. So the idea for this one was they have documentation on how they do project management. And they have an approval workflow where they start off with an idea and then it goes to a committee and then you need a VP and then you need a signature and then it goes to legal and then it goes to finance, so on and so forth. And they tried to create a diagram of all the things that get touched on any project, any procurement. And I think it was like something like 36 boxes, 36 stops. And they said, we still don't think this is right. But what we do have in our SharePoint, because again, all the Microsoft Office 365 apps, is all of our policies and procedures on how things should be. And so the hackathon idea was use those in Copilot because Copilot has the ability to read and write from those if you have the right permissions, to create a workflow diagram for how it should be, and then use the domain expertise to poke holes and see where it's broken. And so that was one of the ideas that we wanted, that you could have as many people or as few people as you want taking documents, not PHI, not super sensitive, especially if it's publicly available or it's not, not a problem, and leveraging the Microsoft Copilot to do that. And it's entirely prompt engineering. So you got to type in prompts, you got to ask it questions, you got to have it generate a workflow. And so that was one idea that we had. So no, it doesn't have to be PHI, it doesn't have to be sensitive data, but it should be meaningful, I would say. And that one I think would have been.
So a bit more kind of like a process improvement hackathon, maybe in this case. Okay,
Exactly.
cool, cool. Thank you.
Yeah, they wanted to see, for the example they had, or the outcome was how many times does the CTO have to approve a project before it can go live? And the correct answer was four. And it was, why are there four touch points for the CTO? Why can't it just be one or two, right? One at the beginning, one at the end. And not just the CTO. Now let's talk about all the other components and all the other people who are touching it or roles that are touching the project, and use your documentation that you have to facilitate that workflow. So it's an idea. We never did it. But yeah.
That
Thank you.
that's a outstanding problem in a lot of institutions, I believe. Like, yeah. Victor, yes, you have a question. I saw you went off camera, so please
Yeah.
feel free to ask.
Thank you so much, Albert. Wonderful presentation. I certainly enjoyed it, having participated in a number of hackathons myself. I understand why you're getting really good results when you do one. Quick question for you. How is it that you round up the participants that will make a really good hackathon?
Yeah, it's a great question. Year one, I handpicked them. Just being honest, the workplace safety, I didn't want to open it up to everybody. It was somewhat of a controversial, right, topic. Little taboo. So I handpicked the people. The second time I put out a QR code for the diabetes hypertension surveillance system, it was non-PHI. It was aggregated data at a geography. I could expand it to more people. So I put out a QR code and sent it out to all of the IT folks at the hospital system, as well as the health plan associated with the hospital, as well as the county analysts. And like I think we said, we had 18 people come in, purely on the volunteer basis there. Now we already have AI governance frameworks. We've got AI committees. We've got all that. So really, it's just getting the word out for those and having, just like an organization of any show. You gotta bring in, someone to collect all that and divide up the teams and all of that. But usually, I've just been the single point of contact running everything and splitting up the teams to try and make them as fair as possible.
Thank you.
I see another question.
Yeah,
How
how do
do
you put teams together? Any influence? Yeah, so Alvin, yeah, I just did it myself. Where so we've got different levels of data science, principal, senior, entry, intern, right? So I try to make sure that I've got at least one principal on each team, and I try to put the R programmers together. I try to put the Python programmers together. But I mean, it's mostly been random number generation plus make and then a couple tweaks here and there. But there's no science behind that. Maybe that should be a hackathon.
you I have another quick question. I mean, I don't know if this is quick, but do you also require, so I know you mentioned that you require them to like showcase performance of the model and what signal are they getting. Are depending on use case, do you also require like some kind of subgroup analysis, fairness, and things like that, or is it like not feasible and is done post you have a good model?
It's done post. We really try to keep that scope. You've got one main objective with a specific performance metric, and that's what we're trying to solve for. Then after the fact, we can do descriptive analysis of bias and variance and how is the model performing on these specific protected classes and all of that. We try to cut through any outside noise and give 10 people, 20 people one very specific thing that we want to solve. And then that one it's a go deep, not go wide, and that one specific problem gets solved really well.
Fantastic. Yeah, any other questions from the audience here?
I have a question as well. Thanks, Albert, for the presentation. I know you mentioned, there are competing priorities within the organization as you think about what the theme for the hackathon would be. What has been your process for prioritizing, and then eventually, choosing the theme for your hackathons?
Yeah, these ideas are coming from the top stakeholders that we have. So the way we operate with the hospital is there's an AI governance committee that oversees the prioritization of AI for the system. And so we work with those leaders to decide what it is. I think I've said a dozen times that we really want it to be something that is big impact. And so we don't take a bottom up approach with it. We definitely take a top down approach. And usually what we do is we pitch a couple ideas. So we'll pitch two or three or four ideas, or if we have a very engaged stakeholder that raises their hand and says, "Oh, I really want to do this," and then that's where we go once we have that stakeholder.
Thank you.
Thank you. Um, any other questions or comments from the audience? Feel free to put them in the chat or ask directly. Yeah.
And I'd be happy to share the slides. I got a couple links in there for folks to see some of the results of where they ended up. And feel free to play around with them.
Awesome. If no other questions, maybe we can just wrap up the webinar today. Oh, Victor, sorry, if you have anything.
One quick question. When you look at a hackathon overall, what really is I'm going to call it the assessed cost to PCCI to have one of these hackathons?
Yeah, I mean it's time, employee time. So we've only
Sure.
done no more than 2 days. We've been talking about going to 3 days. But I mean, there's a cost for, data science time. The global average right now, I think, is anywhere from 100 to 120 all in, right, of the cost of a data science hour if you include fringe and overhead and everything. And so we keep it to just the 8 hours of being there in person for 2 days. And so there is a cost, but in the grand scheme of things, it's nearly negligible compared to the rest of the, overall cost. But it's time. The compute, like we leverage the existing compute resources and what we do every day. As Teresa was saying, like if you've already got Copilot, you've already got a tool, leverage existing tools. You don't need to go out and buy a 50 gigabyte GPU to run a hackathon on such. You've got enough tools. Everyone has enough tools already to do in some scale, something that I'm talking about.
Please, thank you.
Fantastic. Thank you so much, everybody, for joining the webinar today. Thank you so much, Albert, for sharing as well. We will post the recording of the session and the slides on our website, so you can definitely check that out. Oh, I see one more question, Albert, on the chat, right as we were closing from Candice.
Yeah, we usually provide
Yeah,
kind of
meals and snacks.
breakfast. Yeah, we
Yeah.
usually provide like some breakfast tacos, and then we try to keep like the hackathon thing going here with like energy drinks and pizza, and like we try to keep it, just grab and go stuff. I will say this, the teams don't break for lunch. They're so excited and so ingrained that they take the food and they go back with their teams and their groups and they work on it. I think I mentioned this briefly. The hackathon should never be individual. It should never be one person going and trying to solve a problem. You absolutely need to do teams. I'm not sure how explicit I made that, but the bouncing of ideas off of each other, the sharing of you work on this, I work on this, we're going to put it together. That collaboration is going to identify other maybe communication barriers, like, hey, what do we do for our code repository? How are we going to merge our code together? Those types of things get solved too as you're doing it. Yeah, gifts. We did like I think we did like a little speaker. I bought like a little Lego set. I think I had like a little Astrobot figurine or something. And so the judges have a scoring rubric, and then there's a winning team. We usually do the top two teams. I get some sort of small little prize. Again, small stuff. T-shirts are a great idea. We haven't done that one yet.
So Albert, they don't take a lunch break because as you started your slide with the time bound, and
Yes.
there is so much demand there that they cannot afford a lunch.
Exactly.
Awesome. Well, maybe next hackathon increase it by a half day and like give or
They want to. That's always the chief complaint is there wasn't enough. If I had more time, I could have done this. Every single time they say that.
yeah. That's fantastic. Thank you so much, Albert, for your time. Thank you, everybody, for joining our session today. We will post the recordings. You can sign up on our newsletter and for other sessions and webinars as well. And our next session will be in February. Thank you so much for joining us. Have a great afternoon, everybody.
Thank you.